Hi, this is Dr. Kamlesh Kothari here. I am a dental, oral and maxillofacial surgeon. I specialize in the diseases of the mouth, jaws and face with a special interest in dental implantology and advanced dental implants. I am the clinical director of Aesthetica, Kolkata's most premier dental center and maxillofacial surgery center. Welcome to my vlog, The Dental Diary, where I am going to discuss about common man's day-to-day dental and jaw-related problems. Thumb sucking is a phenomenon seen primarily in humans and other primates like chimpanzees and apes. What happens is there is a reflex comfort mechanism and the child wants to insert the thumb or the fingers in the mouth and sleep, or even subconsciously these thumbs and fingers are in the patient's mouth only. Instead of scolding the child, you should rather praise the child when he is not sucking. The child may have some anxiety, try to understand the anxiety and sort that out. The child may require a little bit of a sock or a glove while sleeping at night. Thumb sucking can lead to teasing at school and can also cause other psychological issues, so child counseling is important. If prolonged thumb sucking is happening, then the upper front teeth may protrude out and cause what is called as a bunny teeth, and then the tongue can keep thrusting out and the upper and the lower lip may not meet, and we may end up with a situation called as upper alveolar prognathism. Thumb sucking can be socially embarrassing and the child needs to be taught what are the effects on the teeth and other effects by means of educative videos or taking him to a professional. Once the child is internally motivated, it is easier to get this habit corrected. There can be situations where an orthodontic appliance is required. This is a removable appliance, or sometimes we also give fixed appliance. This is to prevent the thumb sucking because it acts as a deterrent or a reminder whenever the child wants to insert the thumb inside. A pediatric dentist is the best specialist to take care of these kind of problems. And the child has to be motivated, not reprimanded by the parent whenever this happens. Remember, thumb sucking is a curable problem. It's a problem seen only in humans and apes. This is something which can easily be controlled to prevent any future dental problems. Child teeth are prone to developing cavities because of their habits, sugary tooth, and decreased dexterity to cleaning their teeth. Once a child has teeth, other than inculcating good brushing habits and teaching the child how to brush properly by acting as an example, you should also take him to a dentist to look for fluoride varnish. What is fluoride treatment? Fluoride is basically a mineral which is applied onto your tooth to make it stronger. Fluoride creates a strong layer on the tooth which makes it resistant to cavities. Having said that, fluoride is no guarantee that there will be no cavities on the child's tooth. The child has to still take care of his tooth properly. It's a very simple treatment process. It may be required to be done 2 to 4 times a year, normally twice a year. You go to the dentist would assess the child's cavity formation potential and advise to do a fluoride varnish. This can be done in a single sitting itself. You may have to repeat it one more time in the year. A gel is placed on a tray, a specialized tray, which is put onto your child's tooth and left for a minute, and then the child is not supposed to brush or floss his tooth for 4 to 6 hours. The fluoride which is there on the child's tooth gets rinsed the same day itself, and it's very safe. Millions of children undergo fluoride treatment around the world through pediatric dentists. A pediatric dentist is the best specialist to advise what is the right formulation and the right dosage and the right number of visits to get this treatment done. Remember, a fluoride treatment is the best adjunct to tooth brushing and cleaning and regular dental visits to the pediatric dentist.